The psychological underpinnings of depression, how it manifests in a romantic relationship, the toll it can take on both partners, and most importantly, what you can actually do about it, without losing yourself in the process. Chapter 1: Understanding Depression Beyond the Stereotypes. Let's start with what depression really is. At its core, depression is not simply sadness. It's a multifaceted mental health disorder that alters how a person feels, thinks, and behaves. The most common form is major depressive disorder, MDD, which includes persistent low mood, emotional numbness, lack of motivation, and, in severe cases, even thoughts of self-harm or suicide. But depression isn't one size fits all. There are several types of depression. Major depressive disorder, MDD: persistent sadness, hopelessness, fatigue, low self-worth. Seasonal affective disorder, sad depression triggered by seasonal changes, especially during winter months. Postpartum depression. Occurs after childbirth, often misunderstood or stigmatized. Situational depression, a temporary form of depression caused by specific life events such as job loss, a breakup, financial crises, or grief. Persistent depressive disorder, dysthymia: a chronic, low-level form of depression that can last for years. Understanding which form your partner may be experiencing can be helpful, but you don't need a clinical diagnosis to be a supportive partner. Instead, what matters more is understanding how their depression affects your relationship and what kind of support they respond to best. Chapter 2: The Emotional Toll of Loving Someone with Depression. Let's be brutally honest. Loving someone with depression can feel like standing in the rain while trying to hold up an umbrella for two. It's exhausting. It can leave you soaked in frustration, drenched in confusion, and chilled by emotional distance. It's okay to admit. You're tired. You sometimes feel unappreciated. You miss the person they used to be. You feel alone, even when you're together. But here's the truth: your emotions are valid. Compassion does not mean self-sacrifice. Supporting someone with depression does not mean you must ignore your own well-being. Many people in this situation fall into the trap of trying to be the hero, believing they can single-handedly fix their partner. But depression is not a dragon to be slain, it's a storm to be navigated. You need a life jacket too. Chapter 3: 6 Transformative Tips for Navigating the Relationship. Let's move from understanding to actionable strategy. Here are 6 deeply important principles that can transform your relationship with someone suffering from depression. Tip number 1: expect emotional fatigue, and normalize it. Yes, it's normal to feel burned out, annoyed, sad, and sometimes even angry. You're not a bad partner for feeling this way. But rather than suppress these feelings, recognize them, own them, and process them constructively. You might need therapy for yourself, journaling to track your emotional cycle, open conversations with trusted friends who won't judge you. The goal isn't to erase your discomfort. It's to manage it with maturity. Tip number 2: recalibrate your expectations, especially about intimacy. Depression often impacts libido, interest in connection, and desire for physical touch. You might begin to wonder, do they still find me attractive? Are we drifting apart? Is our relationship doomed? The answer? Not necessarily. Desire mismatches happen in even the healthiest of relationships. But when depression is involved, it's essential to talk openly, without pressure, about needs. Discover alternative forms of intimacy. Detach your self-worth from their fluctuating interest. Professional help can also go a long way in restoring emotional and physical connection. Tip number 3: learn the art of validation. Sometimes, the most powerful words you can offer are, "I can see that you're really hurting. This must feel overwhelming. You're not alone in this." Avoid phrases like, "Just think positive. Other people have it worse. Snap out of it." Validation builds trust. It tells your partner, you don't need to be fixed, just heard. Tip number 4: don't personalize their pain. When they pull away, go silent, or seem uninterested, you might assume, they're losing feelings for me. I'm not enough. But most of the time, it's not about you. Depression filters reality. It warps perception. The best thing you can do is not internalize their mood as a reflection of your worth. Tip number 5, set boundaries without shame. Love does not mean enabling. Yes, help them. But don't cover for them. Don't excuse emotional manipulation, verbal aggression, or consistent neglect. Depression explains behavior, but it doesn't justify everything. Boundaries you might set. I understand you're struggling, but I can't allow you to speak to me disrespectfully. I want to help you, but I can't cancel my job every time you're feeling low. Boundaries protect the relationship from emotional erosion. Tip number 6, don't stop living your life. This is key, you are allowed to feel joy. Go out with friends. Keep your hobbies alive. Smile. Laugh. Dance. Post silly videos. Enjoy your life. You're not abandoning your partner, you're anchoring yourself. Your well-being is not a betrayal, it's a necessity. Chapter 4, When and How to Encourage Professional Help. You are not a therapist. Encouraging your partner to get professional help is not a sign of weakness, it's an act of love. Start by saying, I care so much about you, and I think talking to a therapist might really help. Would you be open to trying counseling together or individually? Normalize therapy as self-care, not shame. Chapter 5, Hope in the Midst of Hardship. It's not all darkness. Many couples navigate depression successfully and come out stronger, more compassionate, and deeply bonded. The experience teaches resilience, emotional intelligence, and vulnerability. But it takes honest conversations, consistent support, and ongoing self-care. You can love them. Support them. But don't forget to love yourself, too. If today's video resonated with you, please hit that like button, subscribe, and share your thoughts in the comments below. Whether you've navigated dating someone with depression or you're doing it right now, your experience matters, and it may help someone else feel a little less alone. Stay grounded. Stay kind. And as always, thank you for watching Stoic Advanced Women.